In this unit on ritual, health, and healing, the 3 articles in the film collectively help us see that people's ideas about health and well-being are best understood in relationship to larger patterns in society. They all show how ideas about physical health are firmly linked to broader ideas about social and mental well-being. They suggest that people intuit the connection between body and mind. They intuit, in other words, that social and mental turmoil contribute to physical illness, and vice versa, that physical illness has socio-emotional manifestations as well. These pieces suggest that when people seek out health care, they might hope to be treated holistically with concern for body, mind, and spirit. In this recap, I want to highlight key ideas of each of the sources and then discuss the picture that emerges from their combination. In Melissa Cheney's article, Reinscribing the Birthing Body, Home Birth as Ritual Performance, she shows how U.S. home birth midwives act to reinscribe or redefine childbirth and the mother's body through a series of ritualized practices as they care for mother and child. One valuable insight we can take from this article is that even though rituals always draw upon traditions, they use symbols and meanings from the past, they are not always traditional. By this I mean that their final forms and the meanings and values they communicate might be relatively new or counter-hegemonic, meaning that they go against the mainstream. Such is the case here, as Cheney says that several of these midwifery practices aim to reclaim childbirth from a medical system in which women have been trained to look to medical doctors and technological fixes for all the answers. Instead, midwifery practices subtly encourage women to recognize childbirth as a natural process rather than a sickness calling for a medical cure, and to trust their own bodies and their own instincts. She introduces her argument in this way. Quote, home birth midwives explicitly manipulate ritual in an attempt to communicate the sufficiency of nature over the supremacy of technology, replacing mechanistic views of the body and birth with the language of connection, celebration, power, transformation, and of mothers and babies as inseparable units, end quote. These ideas are introduced through a variety of ritualized practices, including involving the partner and other children in the process, empowering the mother to squat upright and trust her body about when to push, solidifying the mother-infant bond in the immediate postpartum period by giving the baby to the mother right away, having the mother call the baby back as it is being resuscitated, and delaying cutting the umbilical cord, and then honoring the placenta once it is expelled. Throughout the entire process, therefore, the midwives are redefining birth as natural, women as creators of healthy children, and the home as the locus of a cooperative, united family. Then, in his article, The Strange and the Native, Ritual and Activism in the Aymara Quest for Decolonization, Anders Berman wrote about the curious parallels between Bolivian Aymara beliefs about soul loss and indigenous political activism. Aymaras talk about an entity called the Ajayu. It is a sort of spirit that properly belongs to a person, that is linked to the body, but can nevertheless be lost, usually after the person experiences fright, susto. When the Ajayu is lost, the person will act strangely and exhibit physical symptoms such as loss of energy. However, the Ajayu can be recovered intact and unharmed through ritual practices. Similarly, Aymara activists in Bolivia talk about a cultural indigenous essence that has been displaced by past and ongoing processes of colonization. However, that cultural essence can be recaptured intact and restored. Therefore, both Aymara health practices and indigenous activism are based in ideas about essential and proper essences, losses thereof, the imposition of the strange, retrieval of the proper essence, and taming that which is strange. What does this imply? Berman says that it would be a mistake to conclude that indigenous politics have simply borrowed the logic of ancient health practices. After all, Aymara ideas about health and well-being have similarly been subject to 500 years of colonialism. He concludes that both ideas about health and politics have emerged out of, quote, those dimensions of human existence that underpin the present, end quote. In other words, both have been shaped by experiences of colonialism. What this suggests to me is that when the Aymara talk about soul loss, they are also pointing to a repressed cultural existence. The loss of the individual spirit not only parallels, but also reflects the suppression of Aymara culture and oppression of Aymara people under colonialism. By implication, physical health depends upon reclamation of the soul and also restoration of society. Similarly, the film Planet Yoga shows us how the ritual yoga practices are based upon the idea of the union of body and spirit. We see that there are variations in yoga practice, and we look in on the practices of gurus in Canada, India, and even a French religious historian. The health benefits of yoga have been established scientifically and include cardiovascular benefits, improvements in strength, flexibility, balance, and sleep, reductions of stress, anxiety, and depression, and greater awareness and appreciation of one's body, which lead to other healthy practices. Yet, to reduce yoga to a physical practice or a form of exercise would be to miss its other dimensions. Yoga entails physical and spiritual health simultaneously. The word yoga comes from the Sanskrit word yuj, meaning unite, especially to, quote, unite body and mind, humanity, and cosmos, end quote. This is my interpretation, but I suspect that one of the ways in which yoga brings about a sense of holistic or whole body well-being is that the practice involves aligning body and mind. Imagery, or what one sees in the mind's eye, is of critical importance. Yoga aligns body and mind by having the body make poses that correspond to certain shapes. Imagery and embodiment are coordinated and therefore harnessed simultaneously. An important set of images in yoga is that of doors, gates, and paths. For example, in the film, the French religious scholar says, quote, "You're asked to walk step by step through this inner self, your progress through your body, through your mind, toward a certain form of liberation," end quote. She adds, quote, "It's a path to the self, absolutely, that runs through a series of doors linked to our inner barriers and our ignorance. There are always barriers and doors that open when you put in the effort," end quote. The idea of opening doors corresponds with different poses in yoga, such as the gate pose, Parigrahana. The body moves in ways that mirror the images upon which the mind is focused. Similarly, balance is important in yoga, and it has mental and embodied manifestations. Balance is both a mental image of an ideal, and the body gains practice in balance as the many destabilizing poses require the practitioner to activate many fine muscles. One of the Canadian instructors says, quote, "How am I supposed to live in my body in balance and harmony? We have to start with our own body," end quote. He says, "You know the carpenter's bubble where they put the bubble in the middle? Well, think of that bubble point as what yoga's looking for. Breathe, and your mind changes because of the mind-body link. And yoga says the link to the mind and the body is the breath. So postures and breathing help us to get comfortable in our body, get to the balance point." Other poses reflect the coordination of mind and body in yoga, as the poses bear names that correspond to their shapes. Mind and body, therefore, become centered upon the same image. For example, in the film, we see the sun salutation, in which the body goes through a set of movements that represent greeting the sun. As the practitioner proceeds through these movements, they are simultaneously thinking about what it would look like to greet the sun. In the film, we also saw the tree pose. cat pose, child's pose, and the lotus. In addition, in the film, we see that the yoga instructors often utilize imagery to guide proper postures and breathing. For example, the first yoga instructor in the film says, quote, "Now with the tailbone into that space again, soften the heart towards the earth. Inhale and just lift the heart." Her words create mental pictures, softening the heart, lifting the heart, that guide people toward proper postures. Again, mind and body are united through concentrated focus upon an image. It's not surprising, therefore, that yoga can bring about a sense of both physical and mental well-being. The final piece that we considered was Marcus Wenke's article, Social Dimensions of Health, Ritual Practice, Moral Orders, and Worlds of Meaning in Brazilian Candomblé and Umbanda Temples. In his analysis, he reveals how these healing ceremonies contain the same elements that psychotherapists discuss as being critical for mental health, including resource activation, problem actuation, mastery, motivational clarification, and therapeutic alliance. Resource activation involves encouraging patients to marshal their own skills in the healing process. Problem actuation entails helping the patients to identify that which needs resolution. Mastery involves helping the patient to develop appropriate coping skills. Motivational clarification entails helping patients identify behaviors that they might need to change. Finally, the therapeutic alliance refers to the necessity of building a cooperative relationship between therapist and patient. Wenke identifies those same 5 elements within Candomblé and Umbanda healing ceremonies. In those religions, physical and mental illnesses are frequently attributed to spirit possession, often the result of interpersonal problems. When a person who is sick or troubled visits the healer, there will be a dynamic conversation between the client, the spirit medium, and the spirit or spirits that have possessed the client. The spirit medium will ask questions so as to diagnose the ultimate cause, which is often identified as a sickness having been sent by someone else as a consequence of that conflict. Having that conversation about fractured social relationships might help the client identify a source of stress in their lives. According to Wenke, these rituals cultivate optimism. Implicit in the healing process is the notion that, in short order, the medium can diagnose the problem, extract the possessing spirit, and protect the client's body against future possession. In addition, the drama of the ceremony, including the voices of the spirits and how the medium's body moves as it incorporates and traps the spirits, help the client visualize and therefore believe that the possessing spirit has been extracted from their body. In his words, quote, "The ritual promotes a positive attitude and the hope of recovery, which could be referred to as resources," end quote. Furthermore, the hope of recovery he traced to the implied notion that, quote, "a person's suffering is separate from them as a person and that can be dealt with accordingly," end quote. By involving the client in diagnosing the source of turmoil in their lives and by cultivating optimism, these ceremonies can have therapeutic effects on mental health. They can bring about a sense of well-being, or at least that one is on the path to recovery. If I were a healthcare worker, I might come away from these pieces with a few takeaway ideas. When people feel ill, they might be looking for more than just a technical fix to a physical ailment. They might also be plagued by fraught social relationships or feelings of oppression. They might have corresponding mental troubles. In addition to physical relief in a clinical setting, they might also be craving experiences that would help them evaluate their social relationships, empower them to trust their own instincts, give them hope within the context of oppression, and cultivate optimism. Healthcare workers, therefore, might think about not just how to fix something technically, but to be sensitive to how clients might think about health, whether in relationship to colonization, patriarchy, fractured interpersonal relationships, the spiritual world, and not simply brush them off as non-scientific or irrelevant. There may be an entire history behind people's beliefs about health. Being sensitive to those beliefs and aiming to treat the person holistically, considering body and mind simultaneously, would be more productive and introduce trust in the healing process. That's all for now. Now on to our next topic.